Hello, everyone, and welcome back to the podcast. Today we have Miss Bonnie Cheung with us. She's a third-year resident doctor in internal medicine at the University of Toronto, and we're very happy to have her. Welcome to the show, Bonnie.
Thank you. Thanks for having me.
I guess just to begin, could you describe why you decided to pursue a career in the healthcare industry?
Yeah, so it's a great question. I think one of the main things that led me to want to be a doctor is to help people. Um, I, as I encounter doctors when I shadowed them, or even my own personal experiences with healthcare, I just really valued the fact that doctors can have such a they have the privilege to be a part of their patients' lives and to bring healing to their lives. And um, I think the mark of a good doctor is that you need to really get to know your patient, not only from their health perspective, but also their lives in general in order to be an effective doctor and to provide healing. So I really appreciated that and I wanted to emulate that in my career as well.
Yeah, that's amazing. And I'm aware that you are in your third year, but could you describe what you do as a resident doctor,
Sure.
specifically in internal medicine?
Yeah, so I'm in third year of residency in internal medicine. And essentially, as a resident, you go through different rotations. Each rotation lasts for a month. And there are rotations that have to do with specialties within internal medicine. So it can include general internal medicine, where you're looking after patients who stay at the hospital, admitted under internal medicine. It also includes subspecialties. So there's a whole range of subspecialties within internal medicine, including cardiology or respirology or gastroenterology. So we also rotate through that. And this involves a mixture of inpatient medicine, so looking after patients who are admitted to the hospital, and also outpatient medicine, looking after patients who you see in clinic, and then they go back and forth between their home and clinic. Um, and yeah, so generally, like day to day, it's like a regular work day, but we also are on call. So people, schedule us to be on call at the hospital for overnight. It's usually 26 hours of call where you're looking after the patients overnight, where while like the main team is, at home.
Yeah, so it certainly is a very interesting time to be kind of studying in the healthcare industry, all with
Mhm.
the kind of pandemic going around. In particular, could you describe how COVID-19 has affected the structure of what you do at work and your education in general?
Mhm. Yeah, I think overall I'm pretty thankful about the like regarding the position I'm in. Um, I know that the pandemic has really significantly affected um, people in different lines of work and different professions. Um, like people have lost jobs, people have had to alter their jobs significantly. And I feel really grateful to be in a position where I'm still able to work. To be honest, I feel like the day to day is overall still the same. Like we're still looking after patients. We're still, um, especially on the inpatient side, we're like still seeing them in person, still looking after them and um, helping them to be discharged from the hospital. Um, I guess the main difference is that of course, is the pandemic and the amount of patients with COVID that we're seeing coming into the hospital, and also the infection control precautions, the fact that everyone has to wear a mask. Um, I just remember like a year ago, back in March 2020, where I found it really strange that we all had to wear masks and like that idea really strange, but now it's just like the norm. It's a norm for everyone now, like regardless of whether you work in healthcare or outside of healthcare. And And I think like as we approach over a year of this pandemic, I think I think a change that I definitely see is that people are getting burnt out and getting really weary of having to um, deal with like the difficulties of the pandemic. That we're in our third wave now, and like I think a lot of us were hoping that this pandemic wouldn't last for as long as it did. And then on the outpatient side, things are different because we do a lot of virtual care now. So we're either calling patients over the phone or we're having video meetings, much like Zoom meetings with them. And if they don't need to come into the hospital for a clinic appointment, um, for example, something as straightforward as just going over their lab work, then we tell them not to come into clinic. Um, so I think that's been a big change as well. And um, other changes specifically to residency is our curricular changes. So, for example, like in third year of internal medicine residency, you apply for like a lot of residents apply for a subspecialty, and they enter fellowship in fourth year and fifth year. And through the application, residents will usually go to other universities and do electives there, but we had all our electives canceled because of course we had to limit travel. Um, we had to do all of our interviews virtually in terms of like applying to fellowship programs. Um, when there are waves of like the COVID pandemic, oftentimes a lot of residents are taken away from their regularly scheduled um, like block rotations, and they're like redeployed to be on the general medicine service, just to make up for like they need the extra hands. Um, and yeah, I think those are a couple of changes that I've seen over the past year.
Yeah, I think it's pretty interesting. I've actually interviewed someone, a man by the name of Matthew Laffey, and he's actually doing his residency in Ireland. And something
Mm.
I found that he described was pretty interesting is that obviously the situation with the pandemic is a little bit different there. So he doesn't
Mhm.
come into contact with COVID as much because the situation isn't as severe. So the patients he sees usually don't have COVID-19, and they usually try to avoid giving him patients with COVID-19.
Mhm.
What type of patients do you deal with in your residency, and how often do you come across COVID?
Yeah, so I would say as like an internal medicine resident, we often will see patients with COVID, particularly in the emergency department, because um, an internal, like when you're on a call overnight as an internal medicine resident, and you're on your like general medicine block, essentially you see patients who need to be admitted under the internal medicine service from the emergency department. So to break it down, the emergency doctor will see the patient and determine where the patient is best placed. And if they think that this patient would be best suited for internal medicine, then they would ask the internal medicine service, which overnight often involves like a senior resident who's like second or third year of residency, and a few junior residents who are in first year of residency, to see the patient. So because internal medicine is quite broad, like it involves adults 18 years or older with internal medicine kind of issues. So that's pretty much everything that's like not surgical, or they're not pregnant, they're not a child because they're 18 years or older. They don't have like a gynecological problem. We see like a huge variety of different conditions. Before the pandemic, or even now during the pandemic, like common ones would be, for example, heart failure or COPD, which is chronic obstructive pulmonary disease. Often that's common in smokers. They would come in with exacerbations, pneumonia. Um, and because like COVID-19 is considered, an infection, like kind of similar to, it's a pneumonia. It could develop into pneumonia, and so the internal medicine service is often contacted for COVID-19 patients. So that's why internal medicine service sees so many of them. So overnight, we would often admit these patients with COVID-19 into the ward. But I mean, we're also fortunate that it's not only us residents who are providing care. It's of course like the staff that also provide care as well. And we hand over to the staff doctors in the morning, and it's generally the staff doctors who look after a whole ward of patients with COVID-19. Like they try to protect us residents from like being unnecessarily exposed to patients with COVID-19. But overnight, because it's usually residents who are on call in-house, we would be admitting them. In terms of like the percentage of patients, I think it really fluctuates. Like in patients with COVID-19, it really fluctuates with the case numbers and things like that. So when the case numbers are high, we can see a lot of people with COVID-19. But on top of that, like we also see our bread and butter internal medicine cases overnight as well. Yeah.
Yeah, so I think you spoke a little bit about this earlier, but especially now during a pandemic, you really are kind of surrounded by these different dangerous viruses and diseases. What type of safety measures are put in place around you to guard your health as well as those around you? And what kind of changes in your actual workplace environment have you noticed?
Yeah, it's a great question. So I think the pandemic has really made me and a lot of other people realize that like how to properly put on like a mask and a gown, and what's the order in like washing your hands and putting on your gloves. Because I think before the pandemic, a lot of us would be like, oh, this is just for show, or not that's for show, but we didn't like take it as seriously because we were like, oh, we'll just throw on our gloves. But it's actually like a very specific order in
Mhm.
putting on your, like, you have to wash your hands, and then you put on your gloves and then your gown, and then when you take it off, it's like a very like specific order as well, where like you take off the dirtiest part of yourself first, which is your gloves, and then you wash your hands, and then you have to like remove your gown in a way that like doesn't like the dirty part of the gown, or like the patient facing part of the gown, doesn't like hit like the clean parts of yourself. And then you wash your hands a couple more times and things like that. So like we're a lot more mindful of like what proper infection control management is. um, and yeah, in terms of like the precautions we take, so generally like starting from like coming into the hospital, we would have a like a COVID screening process. So like going through all those like symptoms and signs of COVID, and attesting that we don't have those symptoms, we haven't traveled in the past 14 days. Often to like expedite the process of having like staff come into the hospital, many hospitals have made their own like web app to so that you can just like check mark no, and then you just show like your pass to whoever is screening on the front. And then we go in, if they let us go in, and then they always like they usually will give a mask, that like if we're wearing a fabric mask from home, then they'll ask us to switch a mask into like a proper level 1 mask. And then yeah, and then we go in, we have to wear the mask pretty much all times unless we're eating or drinking. And in terms of like social distancing, it's like so it's similar to what probably a lot of people would see when when they enter any indoor building, like making sure we're all like 6 feet apart, and having our own like trying to have our own whenever possible, like our own workspace, and using that same workspace so that we're not like contaminating each other's workspaces. And not eating together as well, like eating separately, has been a change too. Um, and definitely not eating in like patient areas as well, is also important. Um, yeah, just like doing things more spaced out and more isolated.
Yeah, so obviously you're still very young and very early in your career, but the things that you're experiencing, even as a student, are still very different from those in other fields who more or less, especially during this pandemic, are spending a lot more time working from home.
Mhm.
But heading into this pandemic, did you feel as a student or as a resident doctor, did you feel prepared to kind of confront the challenges that the pandemic brought forth?
Um, I don't know. I mean, I feel like I didn't know what to expect, so I didn't really know how to prepare for it. I think coming into the pandemic, I had a lot of anxiety and nervousness because I didn't really um, know how big our waves would be. I'm trying to like pace myself back to how I was feeling in like February, March, and I think the news about how the pandemic was like significantly affecting other countries was just coming out, and how it was putting such a burden to our healthcare system, like to the like countries' respective healthcare systems. So I was really worried about that our healthcare system would be like stretched to the point where we would have to go to really extreme measures to provide care for our patients. So I was worried about that. And I think right now, like we've been heading that direction, unfortunately. Um, so yeah, so I think the fear of the unknown was like my main source of anxiety at that stage, at that early stage when the pandemic first started.
And I guess I'm just wondering, and if you're comfortable speaking about this, how does your family actually feel about you working in hospitals during this pandemic?
Mhm. Yeah, so initially they were worried. I'm still living downtown, and um, they like they live they live up more uptown in Toronto, and so I was trying to not be in contact with them very much, um, and yeah, they were worried. They would tell me to make sure I wear a mask and wash my hands and things like that, um, and yeah, and I think my friends were also worried as well, and I really appreciated that their concerns for me. I just remember when the pandemic first started, that people would be like sending like masks over to me, or like giving me their goggles and things just to make sure I was protected. So that was really nice of them. I really appreciated their care. Um, and but yeah, I think now that we have like a better idea of what the COVID-19 infection is like, and how to um, how to handle it, that they're less worried. People are getting vaccinated now, so that's great. But yeah, I think they were definitely worried when the pandemic first started.
And I guess I'm just wondering, could you speak to kind of how those around you, your coworkers, maybe others that are working on the front line, especially in the healthcare industry, how have you noticed their kind of mentality, their physicality, their kind of social lives? What exactly are the ramifications of serving on the front line during this pandemic?
Yeah. So I had mentioned earlier about burnout. I think there's definitely a sense of burnout, and a lot of a lot of things come into that. A lot of factors come into that. I mean, obviously, I don't know like the ins and outs of every stressor that my colleagues are facing, but I think generally speaking, there are a couple of common factors that contribute to burnout during this time. So the first thing being that we don't know when the pandemic will end. Um, if you don't have an end in sight, that can and like a kind of a finish line to work towards. I mean, we do have a finish line, but we just don't know like when that is. Like we don't know if it's after 20 kilometers or 30 kilometers. Um, I think that makes it difficult to continue working. The other aspect is isolation. I'm pretty fortunate that my family is nearby, and um, I can see them socially distanced. But there's colleagues who haven't seen their family in several months because their families are, overseas or in a different province. So that isolation can be really, really difficult for a lot of people. And um, like, I guess specifically for our year in third year of residency in internal medicine, and for many other programs as well, we have to study for a licensing exam to pass like our internal medicine, general internal medicine certification. And just studying during the pandemic is really tough. There were, a lot of residents who felt like particularly burnt out while they were studying for the exam because, on top of studying for exam, you're dealing with a pandemic and you have to care for sick patients, and things can get quite busy in the hospital. And how are you supposed to study for an exam when you're also trying to control a pandemic? So I think that was really tough, for sure. And I mean, educational impact wise, like I would say that all the residency programs do try to make like every effort they can to keep things as normal as possible in terms of the curriculum, and make things virtual, and try to make sure that we're still learning, because we are still like a residency program. We have to learn how to become full-fledged physicians. But it's not the same virtual learning as you and everyone else knows. It's not the same. um, and like we don't get to see each other in person anymore, and it's just not as engaging sometimes, even though it's convenient. Like you just you can log on from anywhere. It's not as engaging. So yeah, I think those are a couple of common factors that come to mind in terms of what contributes to the burnout. And just in feeling powerless as well, like you want to make a change, and like you would hope that um, that the healthcare workers are working in line with the government. But I see a lot of like um, um, conflicts between the two, and disagreements and things like that. So sometimes you feel a bit powerless as to like how to make things better. um, and But like I definitely know a lot of colleagues, including staff and residents, who have done a lot of advocacy in terms of um, trying to improve equity in this pandemic. And yeah, that's been really admirable.
And I guess just as a final question, you are speaking to largely a high school audience. Are
Mhm.
there any parting words you'd like to offer about what it's like to learn on the front line, to work on the front line, especially during a pandemic of the scale we're working on now?
Yeah, parting words. I mean, I guess as a high school, I'm just trying to think back to when I was a high school student. Um, I think, uh, yeah, I think as a high school student, of course it's hard to determine like what it's actually like on the front line until you actually work on the front line. Um, but like don't hesitate to ask um, healthcare workers what it's like, and um, how you could support them as well. And if you're interested in a career in healthcare, it's still great despite the pandemic and all of its tragedy. It's still very rewarding, despite the burnout. It's still very rewarding, and like I have so many amazing colleagues, and we're all trying to support each other. I'm really inspired by all of them. So definitely don't make that a deterrent if you're considering a career in healthcare. Um, and yeah, I would also want to empathize with um, all students, including high school students who have to study and learn in the pandemic, because you don't get to hang out with your friends or like, have a normal high school life, which is like, yeah, it's really tough. It's not only tough for us healthcare workers, but it's also really tough for all the students out there because like the high school community and life is like such a, it's such a memorable part of growing up. So I just really hope that things can normalize to a point where everyone can hang out again in person and develop their friendships and stay connected. And yeah, I would encourage you to try to be creative in terms of staying connected um, as like the pandemic resolves. Yeah,
Ms. Chung, I really appreciate your time. Thank you for joining me today.
no problem.
Thank you all for joining me today and listening to my conversation with Nurse Bonnie Cheung. Bonnie's story as a physician in training is nothing short of fascinating, but is also similar with the experiences of countless other Canadian med students undergoing their education under similar circumstances. I hope you were able to learn as much as I did from her. Until next time, stay safe and stay curious.